Okay, doctor, you may start.
Hello, I am Dr. Nadir, one of the child and baby doctor here. You are probably Mrs. Mary, mother of Kiran, 3 years old.
Yes, doctor, I am mother of Kiran.
Good afternoon and welcome to you, Mrs. Mary.
Good afternoon, doctor. Thank you.
Mrs. Mary, we are here today to discuss uh, about the condition of the Kiran. Would you like to invite somebody else on our meeting?
No, doctor, it's okay. I came along with my.
And okay, is it suitable time to discuss with you?
Yeah, doctor, I'm here to discuss with you about my baby's condition.
Okay. Mrs. Mary, first of all, I want to know that how is Kiran nowadays?
She's fine, doctor. As you know that she is cannot walk properly.
Yeah. May I know how much you know the health condition of Kiran actually?
Actually, doctor, the GP sent me to you. I went to the GP that my baby is unable to walk properly as I compare the other babies. So initially, he told me that she will be fine and toddler age is normal. But now he said, no, you have to go to the big hospital and see the doctor. She might have some problem.
Yeah. Actually, Mrs. Kiran, let me define you that I'm really sorry to tell you that initially that the Kiran is having one of the condition. Its name is, it's medical terminology. It is a little bit difficult. I will be defining you. It is developmental dysplasia of the hip. Ever you heard about it?
Yes, doctor, I told my doctor at that time that my baby is suffering from this condition. Please refer him to the other doctor, to the bone doctor. But he said, no, it's not this condition because she is toddler in this age. This is normal walk. And I know this is could be some problem. But I don't know why that doctor has not referred. I want to complain against that doctor. And now he told me that
Yeah.
my baby has developmental dysplasia of the hip.
I actually, Mrs. Mary, I can see it's a really a valid concern. But let me define you first that as this condition already you know is actually in the after the birth, this condition can be missed as the baby is after the delivery of the birth. The baby is in the position that
ये लाए
uh,
थे अपन पहले
we are-
तैयारी नहीं आ रहा आते हुए ट्यूशन
Please mute your mics.
okay. Okay, this as you know that after the birth, the baby can have this condition like can have like a he was newly born and sometimes on only in the examination this can be messed up. Are you with me, Mrs. Mary?
But doctor, I told that doctor when she was very young that do the ultrasound because one of my daughter of my sister, she is suffering from this condition. So I told him that this is I have a family history. So please do the ultrasound, but he refused.
I can see your concerns, and it's a really genuine concerns, Mrs. Mary. But you know, actually, we are not sending all the babies for the jelly scan. There are some criteria. If that is fulfilled, then we are sending. Like the babies who are just, as I told you, as I defined you, that this condition can be missed in this after the birth. So, are you with me, Mrs. Mary?
Yes, but I have a family history, doctor. So even though I told my doctor that I have a family history, and I read on internet that if there is a family history, it could be the chance that the baby has. So why he didn't
Yes,
do ultrasound?
Mrs. Mary, I really see your concerns. It's really amazing to see that how concerned mother you are. There are the actually other reasons for this condition. This condition can be when the baby is. Let me define you that when the baby is coming out, uh, if the position is somehow is like normally the head is coming out. If the legs are coming out, Then during the pulling and pushing the situation, baby can have this condition, or the baby is weight more than enough. In these conditions, are the family history, as you're telling that in these conditions, yes, it can be, this condition can happen. Uh, are you following me? Am I clear so far, Mrs. Mary?
Doctor, you mean to say if there is any problem, then you will do the ultrasound, but if there is a family history, you will not do.
Actually, only the family history, on behalf of only the family history, we are just examining the child properly, and we are keeping our eye on the baby, and we are examining. If we found some of the during the examination, some clicking sound while the examining, then surely we are referring. But the first 7 days initially, even then, even this ultrasound jelly scan will not be useful. This we are doing after the 1 week of the life. Is it clear so far, Mrs. Mary?
Yeah, but now she's 3 years. They didn't do. So, will you do ultrasound now, doctor?
Mrs. Mary, actually, at this
6
time,
minutes.
just uh, Mrs. Mary, at this time, what we are going to do, we will be just doing the X-ray of the hip, and we will be referring you to bone doctor, and will involving by a consultant, and we will be and we will be, if needed, we will be treating according to that condition.
Does she
Is it clear
be?
so far?
Does she will be complete? Does she will be fine completely, doctor?
uh, Actually, Mrs. Mary, always hope for the best, but uh, some conditions it is recovered, and some conditions it's like if we count like 30 percentage, the patient, or after the they 30 percentage they will be okay by themselves. 30 percentage we need some maneuvers, and 30 percentage, yes, we are just leaving to other conditions, like there can be the one leg can be the like short, and we will be monitoring and treating according to that condition.
Oh
Am I
no,
clear so
doctor,
far,
this
Mrs.
is
Mary?
this is this is very bad news. This is the fault of that doctor. He didn't me refer to the early. If he will be referred early, so it could be preventable, right?
As I told you, Mrs. Mary, that initially first week of the life, even if we do the scan, we will not be picking up this condition. And so it is not actually the fault of the doctor. It is just what we are doing according to protocol of the examinations.
So does she need surgery now, doctor?
Mrs. Mary, we will be consulting the bone doctor, and he'll be defining you everything clearly. Mrs. Mary, if you don't mind, I think I have given a lot of information regarding this condition. If you don't mind, can I summarize whatever we discussed today?
Sure, doctor.
Okay. Mrs. Mary, you brought the 3 years old Kiran as he is diagnosed as a DDH. It's a developmental dysplasia of the hip. And I defined you there are some other causes that can be happen. And you told there's a family history positive. And now we are just going to refer to the bone doctor, and I'll be involving my consultant for this condition. And I will be giving you some trusted websites, some leaflets, as you can have more knowledge about it, and as we can be on same patch also.
Okay, doctor. Thank you.
And I will be giving you some telephone numbers of the family whom you can concern, and how they are coping, and they will define you that concern, that condition. Is it
Sure.
clear so far, Mrs. Mary?
Yeah.
Thank you, Mrs. Mary.
Okay. So 5 seconds remaining. Okay, completed. Yes, Dr. Nader, how do you feel about yourself? How was it?
I think it was actually, sir, good one, but I think mother has a lot of knowledge about this one. I should have to start from the, like I will have to make the bone socket, but as she told that I have the one condition already, she knows a lot. So I
Yeah,
started.
that why I felt that you want to explain about the developmental dysplasia of the hip. But actually, if you will read the scenario and your task, then it would be easy for you. So, as I mentioned earlier, that if you have the scenario of the child who is diagnosed with acute lymphoblastic leukemia, he is on chemotherapy. Now your task is tell the mother about that significance of fever. So when you enter in the room, do not be hesitate to tell the mother that I came to know that your child is suffering from the condition called acute lymphoblastic leukemia. He is currently on chemotherapy, and I'm sorry for that. Yeah, or anything else you can add. Do not be hesitate to say this because it is the scenario mother already knows, right? So here,
Yes, sir.
mother knows the diagnosis, right? Here,
Yes, sir.
child already diagnosed. So these things you should keep in mind. These minor things you should pick up from the scenario. This is the reason candidates are going inside already in their mind that I have to break the bad news of developmental dysplasia of the hip, because earlier they did the breaking bad news with their colleagues and they read from the previous papers, but in exam, there are minor things you have to notice. What is your task? Either child is already diagnosed or not. Is it a breaking bad news, or is this information, or what is the concern? It's apologize scenario. So these things you will get during the exam day from the scenario. So here scenario is saying that child has been diagnosed with developmental dysplasia of the hip. It means mother already knows about it, right? So
Yes, sir.
here your task, and next thing you should have to be look at your task. What is your task? Address her concern, right? If
Yes,
you
sir.
will go to your task, address her concern and give her management plan. These are the tasks. If you complete your task, then you are at the safe side. Otherwise you can lose the marks.
Okay, sir.
Okay, so
Yes, sir.
that's okay. Otherwise, your communication, repo, and other things was fine. The only thing which I will comment on that accuracy of information, okay, and
Yes, sir.
management concerns and agreeing next step. So I have these two areas I have concerns, but your verbal and listening communication skills, rapport and communication style, it is there are four things as they will assess you in the exam: rapport and communication style, verbal and listening communication skills, and information sharing, accuracy of information. Third and fourth one is management concern and agreeing for the next step. Okay, so now if we come in this scenario, if you want to ask her about the developmental dysplasia of the hip, already she told you that I know what is developmental dysplasia of the hip. If you want to explain, it's okay, but give just definition condition where the ball and socket joint of the hip does not properly form in the babies and young children. Okay.
Yes, sir.
So the hip joint at then if it is a breaking bad news, if mother doesn't know what is it, then you should have to draw the drawing. And after what you will draw, you will draw the socket, and you will draw the head of the femur.
Sir, I have one
Okay.
question, sir. Before,
Yeah.
before,
Sure,
sir,
sure. Go ahead.
sir, I thought that I will have to start a way that I will have to define about everything DDH, and I was confused little. Should I define or should I didn't define?
See,
How to
this
do
is
it,
very
sir?
good question. This is the lot of confusion is, and this is the reason can be so when you have something in your mind from outside the scenario that I will tell her about everything about EDH. And when you enter in the room and role player is asking you the different questions, which you are not prepared mentally outside the station. So
Yes, sir.
keep in your mind the broad, once you understand the scenario, that what is this scenario, what is my task, then it would be easy for you, what I have to tell, right?
Okay.
So if mother is asking you, or she doesn't know what is DDH, she told you that I have even in my family member someone has DDH. She
Yes,
knows
sir.
even about the ultrasound, and she knows even
Yes, sir.
about that early ultrasound can prevent more, can have the good outcome. Okay,
Yes, sir.
so she has a lot of knowledge about basic knowledge of the DDH. So no need to go, no need to best, just address her concern. What is her concern now that GP did mistake? Right? And this is the mistake
Yes.
actually.
But we cannot say, sir, in the mistake, we cannot label the mistake of anybody.
You should have to be the truthful, and you are not apologize here because it is not your mistake, not the mistake of your hospital. Okay,
Okay.
you should
Yes, sir.
cover your colleague, yes, but do not be straight away. No, it's not his mistake. Don't say this. You can say
Okay.
it is not 100%. Sometime it happens. It's very difficult to pick up in early age. Okay, and
Okay.
why don't
Yes,
you
sir.
do the ultrasound in all babies? Okay, so the other here, the key thing is that DDH is if they have the first degree relative, means child has any sibling who has
Yes, sir.
suffering, or the parents who was suffering with the DDH, then there is the indication of ultrasound. Okay, otherwise
Yes.
no. They're not doing in every child ultrasound. Because she told you that daughter of my sister, she's not the first sibling, she's not the first degree relative.
Yes, sir.
So here you should have to say, yes, you are right, but we are doing in a ultrasound if there is a first degree relative who is with the same condition, like the parents and siblings, that's it. But your sister's daughter is not her first degree relative.
Okay, that's why. Yes,
Yeah,
yes,
this is the
yes.
key. Okay. Then she told you that I told GP to do ultrasound and this thing. This we are not doing ultrasound in every baby. Why don't you do the ultrasound in every baby? What is the reason? Because of false positive results. Okay,
Okay.
so some babies, if they don't have a click or anything, and we will do ultrasound in every baby, they might have the false positive result, which can create a lot of anxiety and tension to the parents that my baby has this condition. And finally, they said, no, it's not this condition. So this is the one reason. Okay, the
Yes,
other
sir.
reason
Great.
is cost effective, which we are not telling the parents. Okay, so here, this was the thing. If you will tell the mother this thing, she might go ahead and she will ask you the next question.
Yes,
Okay.
sir. Yes, sir. Thank you, sir.
Mm. So one more thing, sir, we cannot apologize for the mistake caused by somebody else, but at least we can say that we are really sorry to hear that your baby is having this problem, but we can be empathetic.
Yeah, exactly. We should have to sorry. It's okay. One time, it's okay. Or even two times, it's okay. But we are not to apologize in this scenario. Saying sorry, it's okay. It's the kind of sympathy and empathy. That's fine. Because you are saying sorry because of she felt this way. She is sad. So that's okay. But apologize, no. Please check your
Actually,
noise. It will take me time to mute actually. If you speak,
sir,
you can
actually,
open. Yeah, Dr. Nader.
mostly, sir, actually, this scenario was tricky, little bit tricky. Mostly the newborn coming and is still not diagnosed. Mostly coming like this
No,
scenarios,
no, no.
but it was
Two
a little different,
exams
sir.
in 2022 or in 2021, I think it came in the same way, which I will say totally exam scenario.
Great, sir. Great.
Okay. Okay. The other
Sir,
thing.
actually, you were
Mhm.
you
Yes.
are right, sir, that most of us make the same mistake that we don't read the scenario and we don't read the tasks. What tasks are actually given to us? We
Yes,
just go
yes.
through the scenario and we don't focus on the tasks given to us. Actually, the
Yeah.
thing is that we have to focus on the tasks given to us. We have to actually cover those tasks actually.
Yeah.
And
Task
everybody
and
among us makes the
previous
same mistake.
knowledge, how much knowledge the parents have, how much they know, how much that, because do not be hesitate to say whatever it is in the scenario.
Yeah, exactly.
Exactly. Start from there. Like in the Breaking Bad news, if the patient who has been diagnosed with acute lymphoblastic leukemia after bone marrow biopsy and consultant told you to inform the diagnosis, so your first statement after repo is to tell the diagnosis and then stop. Do not be hesitate
Yeah.
because this is our job.
So we'll
Okay,
be
sir.
judged according to that only.
Yeah. So if you will tell her about 3, 4 minutes the diagnosis, then what you will give her the other knowledge of the acute lymphoblastic leukemia. The time will be finished. So first, after repo, you have to give the breaking bad news. Then she will ask you the different questions. So okay, so we will come back in this scenario. Here the key was which I told you. The other thing regarding the management. Okay, so regarding the management is in this child 3 years developmental dysplasia of the hip. You should know that this child needs surgery, open or close reduction. Okay, it was good
Yes, sir.
answer that you give. The orthopedic doctor will describe you or decide what to do, but you should know. Examiner also observe your knowledge. That are you aware that DDH needs surgery in this age? So you can inform the parents, yes, or we will do the X-ray. You told me it was great. We will do the X-ray and we will arrange a meeting with the bone doctor, and she might need a surgery. Okay, then if you will tell this thing to mother can ask you if you diagnose early, she will not go for surgery. Yes, first 6 months, 3 to 6 months, pelvic hardness. Okay, she might ask you, why don't you do ultrasound now? Why are you going to do X-ray now?
Because I think we should have to reply after 6 months. It will be better if you do the X-ray instead of the ultrasound.
Yeah, because cartilage and these things will be strong. If baby grows, it will not diagnosed by the ultrasound. It will be diagnosed by the X-ray. Okay, so you should have to then agree for the next agree for the management, and the next step, which is refer to the orthopedic and arranging meeting with the orthopedic. So this is the scenario, which is very simple. Only you should have to do not assume anything in your mind when you enter in the room or when you read the scenario in the exam. You should know what is scenario. Do not discuss anything which you have discussed with your colleague, because maybe you have discussed the breaking bad news of DDH. So now it came here, this is easy scenario. Okay, I will go. I'll just, I know about DDH. What is this ball and socket joint and this and this. And when you come out and result will come, maybe you get the 4 marks or 3 marks. So you did not get, you did not understand your task. Okay, so this is the reason
Yes,
that many candidates are losing marks in the exam. This is in every station, even in the history station. I remember one of the candidate, he has been one young girl with joint pain, both knee pains for 4 months, more than 4 months. And he kept in his mind about the GIA. Okay, his mind was all GIA. He asked everything about the juvenile idiopathic arthritis. He discussed with the examiner about GIA. Examiner was trying to ask to tell me something else, DD and this and this. Finally, this girl was having SLE. It was not GIA. So it was his mind that this is chronic arthritis. So it is 100% GIA. I will not think anything else. So you should have to broad in your mind. Do not diagnose. Okay, you make the DD first GIA. It's okay from outside, but you should think about other diagnoses, and you should have asked the history plan, whatever is the history. If you will, you might have the history. How to ask about the question in the history. Do not ask focused GIA history. You should have asked the general questions as well. Maybe you will find something else. If you find something else, you should modify yourself. This is the big problem for the candidate. They are not modifying according to the scenario. So you should have to be focused, and you should have to be modify according to the scenarios, according to the skills. And these exams is literally is a trick, actually. It will not assist your knowledge. Yes, knowledge is there, definitely. But knowledge is secondary, and they will see other things as well.
I have a question. Can I ask,
Yeah.
please?
Sure.
I
Who is
think
your
you
name? Can you
mentioned
tell your name, please?
yeah, I'm Dr. Noman from Riyadh.
Yeah, welcome.
Yeah, I have a question. When a mother asked, like, why she was not informed before, what is the passing statement that we should tell? The statement that should which score the marks. Can you briefly tell us?
Why mother concerned that why it is a late diagnosis, even though she told the GP and
Yes.
GP did not picked up early. Am I right?
Yes. 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 Yes.
Okay. So at that time, yes, we are doing screening in all newborn babies. Okay, and also we screen again in at the age of 4 to 6 weeks. And if we find that if child has any click sound or any concerns of developmental dysplasia of the hip, immediately we will send for the ultrasound. We'll give appointment for the ultrasound. But if that examination are doing by the well-trained doctors, and it can happen that this can be missed sometime. So that's
Thank
it.
you. Thank you, Dr.
Welcome.
Waqar.
Yeah, welcome.
Can you also summarize this case? How will you the summary will be like in your own words?
Yeah, sure. So in summarization, that is a good question, Dr. Noman, you have asked. Usually summarization, because I'm conducting mocks and I have a lot of discussion with the candidates. So when they summarize, they will tell everything what they have already mentioned in all scenario A to Z. Summarization should be in 2 to 3 lines. The summarization means summarization. It's you should have to extract your all discussion. Okay, so summarization led me to summarize what we have discussed today, that Karen is suffering from the developmental dyslexia of the hip. We are doing X-ray of her hip, and we will arrange the meeting with the bone doctor, and she might need the surgery, and bone doctor will explain you further. And I will provide you the trusted websites and leaflets, and you can read and you can understand more about this condition. If you have any question, any concern, we are here for you. We can arrange a meeting for you. That's it.
Thank you, sir. Thank you.
Diagnosis, your plan, next step. That's it in summarization.
Regarding one question that she asked her, you're going to be surgery or no? Can we answer that depends upon the X-ray or the outcome, and the bone doctor will tell you in detail regarding this. Our different bone team will help. Is this a valid
Because
answer?
no, examiner will see your knowledge about the DTH. You know
Sure.
at what
Okay.
is the ultrasound, at what is the surgery, at what is the X-ray, and if it is first degree relative, what are the consequences. So these all things they will see.
So we should
Okay.
mention this, right?
Yeah,
Sure.
it's surgery,
Thank you.
100%, sure,
Thank you.
and there is no doubt there is surgery, right?
Yeah.
So it's better
Okay.
they are saying in the first meeting, if you will tell something in their parents' mind, it would be easy for the next doctor to explain them.
Okay. Thank you.
You're welcome. If clean black and white scenario, no need to hesitate to say. But if there is doubt, yes, you can say about the bone doctor will decide or other team will decide. But if even you have doubt, so better for the safe side, maybe if a good examiner, maybe you will not cut the marks. But if there is a key from MRCPCH, maybe you will cut the marks. So it depends. Okay, so you should read from the I think guidelines, NSS guidelines, everything is mentioned about the developmental dysplasia of the hip. And now you know actually this is a very easy scenario. There are 2 types of scenario. One is breaking bad news, one is late diagnosis. So breaking bad news, you know, you have to tell everything what is DDH and ball and socket joint and all these things. And then you should have to tell the mothers what the risk factors is, the breech presentation, and baby's weight is more if there is a already first degree relative who has with similar condition, difficult labor, all these things will come in the risk factors. So these you should have to explain the risk scenario with almost. You will do the ultrasound for further because you find the click only, and you will do the ultrasound, and at the age of 3 to 6 weeks, pelvic wholeness. Okay, that will be done by also not by you. So I think all the many years ago, one scenario came in for the pelvic harness management, how to take care at home. So I don't think so recently they gave, many years, 5, 6, 7 years before. So I don't think so you should have to waste the time, but you should know the name of pelvic harness 3 to 6 weeks. After that, it is a X-ray and surgery. Any question?
No, sir. Thank you, sir.
Okay. So there is a recording. I will try to post in the group this recording. I hope this will help you.
Thanks a lot, sir. Thank you.
Oh, yeah.